We are working on every chiropractic patient in your office saying yes to your recommendations, scheduling those visits, actually showing up for all those visits, and even paying for their care. But not just that, we also want them to go out into the community, drag all their friends and family into your office, pre-sold to do exactly the same thing. Those are Wednesdays here on Coffee with Dr. Scott. We're working on perfect case acceptance. Stick around. All right, good morning. Happy Wednesday to you all. We got a good show today. Not a good show, we got a great show today. We're talking about there's no selling in healthcare. I'm going to show you how to have power and balance in your presentation without feeling like you're selling to patients. So, first and foremost, what is the question of the day is, what is the last thing you bought on Amazon? Just a fun little question to get some conversation going. So put that in the comments down below if you'd be so kind. See, for me, we just had a package show up yesterday. I believe it's already down in the comment section, which is one of the coolest things ever. It's a dog nail grinder. We've always clipped the dog's nails, and it's painful. I hate doing it. The dogs hate it. They're always pulling away, and it just gets frustrating. Bought this nail grinder, something I had heard about, friends shared with me, and I was super excited about it. So, let me make sure. Okay, so I decided to grab it on Amazon, and the dogs, they don't hate it. I'm not gonna say they love it, but they don't hate it. They actually were sat there while we ground the nails down, got way more off than the clippers did. And if you have dogs, look into a nail grinder. Anyways, let's go get into it here. So last Wednesday, I talked about how there's 3 stages to case presentation, to getting perfect case acceptance. Stage 1 is chaos. When you just open your practice, nothing's going right. You don't even know what you're doing. Stage 2 is to get some systems in place where you're, maybe you go out and get a coach and you figure out some scripts and you work on some stuff and hopefully you figure something out. Stage 3, which is really what we're working towards, and what I call a level 5 practice, if you remember that from last week, is where there's no presentation at all. You have validity. You have more patients coming into you than the practice can actually handle, than they can accommodate, and patients are pre-sold because they know that they're lucky to be there, so you really don't need a case presentation at that point. And that, to me, is the ultimate goal, is to not have to have any kind of selling, which is what we're going to talk about today. But the problem is you can't start there. Okay, you've got to work your way up to there. You got to get out of stage 1 as quickly as you possibly can, and then you've got to perfect stage 2, where you do have these systems in place, and that is what we're going to be talking about here in the perfect case acceptance. So we're working on stage 2. We're working on getting you what's considered a balanced approach, in my opinion. So a balanced approach is something that does not confuse the patient. It doesn't offend the patient, but it still has power. Power that doesn't look like you're overpowering. Powering that doesn't make you come across like you're a used car salesman. So you're going to have to get that balance, and you're going to have to get that power, and that's what we want to talk about. So that's what gets you up to the validity stage. And once you reach that validity stage, the case presentation pretty much just drops away. And again, at that point, people realize they're lucky to be there, and they don't need that. So validity, that stage we talk about, is where it seems like you're the only one that can do what you do. And when you hit that stage, it's a really nice place to be. And there is a way, by the way, to get what I would consider instant validity. There's a shortcut, but we're going to talk about that much later on the show here. But there is a shortcut. I'll get there, but I really want you to work on getting true validity first and foremost. So we've got to get this balance, like we talked about, where you're strong enough in your presentation to move patients to action, but you're not so strong that, again, they feel like you're a used car salesman. If you're too weak on the other side, you sit around after the patient leaves wondering, did I do enough? Could I have done more? Did I do too much? You just don't know because you've kind of confused the patient. They leave and you don't know how you did. Again, our goal here is to get that validity where you don't have to sell anyone anything, and that's the goal of anyone. I just said, like I said, if you're too weak, you end up wondering if you didn't do enough. If you're too strong, patients say yes to you, right? But they're saying yes just to get out of the clinic. And then they end up not showing up for the next appointment. And we don't want that either. So So, having said all that, have you all seen A League of Their Own? Where, let me see which one do I need here. Sorry. Tom Hanks, Gina Davis story about World War II baseball. All the men go off to war, so the women are playing baseball. Gina Davis misses a pop up at shortstop, and Tom Hanks, our most famous coronavirus victim at this point. How's he doing, by the way? Anybody know? Like, we heard he had it, but I don't know if he's gotten any better. Let me know in the comments if you do know. But anyways, he comes out in the field. He's like, no! She starts crying because she missed the ball. He's like, there's no crying in baseball. There's no crying in baseball. Great line, obviously. Very often quoted line. But I have a different way of saying that, and that is that there's no selling in healthcare. And I will cry in order to get that across to you, because there is no selling in healthcare. I've seen a lot of docs that are taught selling, maybe by practice management consultants or that, and I have seen the aftermath of it, and it's ugly. Being seen as selling destroys practices, and that's what I want you to avoid. Now, yes, you have to sell. Quite honestly, you have to sell, but you cannot be seen as selling. There is no selling in healthcare. Do we got it? No selling in healthcare. Once a patient perceives that you want their care more than they do, you've crossed the line. You've crossed the line over into selling. You're now perceived as selling, and we don't want that. No one wants to feel like they're being sold by their doctor, or no one wants to feel like they're being closed or being pushed to do more than they want to do. It just doesn't feel right. No one wants, in this day and age, no one wants to be controlled or manipulated by a doctor, by a car salesman, by anyone. Once someone feels like they're being sold, once they feel like they're being pushed beyond what they're comfortable with, they all close up, right? And you've probably seen it. And then they do commit, but they commit to not being sold anything. And we certainly don't want that. The automatic response at this point is for a patient to say something like, I want to think it over. Have you ever heard that one before? I want to think it over. But what does I want to think it over mean? I want to think it over is just their way of saying, I want to go home and forget all about this. You know that when someone says, I want to think it over, it's too late. And unfortunately, some poor souls, some doctors weigh in at this point. They start overcoming objections. And some of you may have been taught that. If you start overcoming objections at this point, you start trying to push a little harder. What is it? What is it that you want to think over? Maybe I can help you. If you start having that conversation with somebody, you've completely blown the case. You got to realize that it's too late at this point. You've already screwed up. You need to back up and figure out what you did wrong to get to this point where they want to think it over. You want to back up and figure out how you did not present enough value, how you have not shown enough validity that they want to think it over at all. Because once they say that and then you start pushing, patients start sizing up the opportunity for bolting for the door. They start trying to figure out how they can get out of this office without being tackled by you or one of your staff enforcers. In fact, at this point, they're just being polite. They're just nodding their head and going along with you because they think that maybe you locked the door and they can't get out anyway. So you cannot do this. This is a sales method. Overcoming objections, again, is too late. You've got to go back up, figure out what you did wrong, fix your presentation, get better systems in place, and allow the patient to make that decision for themselves without feeling like they've been controlled or manipulated. So, as I've always said, case presentation is a system, and every system has steps. Every system has a sequence, and that's what I want you to work on. That's what we're going to be working on every Wednesday for the next several weeks as all this coronavirus scare is going on. I want to introduce that sequence to you today, that system to you today, and I want you to get a good feel for what we need to develop. But this system, this sequence is designed to get that balance. Not too strong, not too weak, not allowing the patient to feel like they're controlled or manipulated, giving them enough control, which, if you remember, is one of the 6 C's of referral essence, which we'll be talking about tomorrow, is giving the patient control, allowing them to make the decision. So they feel like they signed up for the care, they bought the care, but they weren't sold the care. And that's very, very important. There's no selling in healthcare. You got it? So the system of what I consider a level 5 practice, if you remember that from last week, somebody who again, their practice is just humming along. They don't really have to do a presentation at all. They have that validity and their practice is humming along. The system involves 7 steps. 7 essential compliance components, and they are in order. So, in order, they are this. One is pre-framing, which includes permission statements and pre-negotiations. Don't know what that means? We'll get into it. That's coming up real soon. But pre-framing, and this is one of the points, I don't want to go off on a tangent here, but as I look at practices, one thing that very few doctors do is set up the case. They walk right in the room and they say, so tell me what's going on with you. But they don't pre-frame what they're trying to accomplish. And it's a huge secret tip for starting the conversation with you in that power and that authority without seeming like you're being overpowering. So pre-framing, number one. Number two is the diagnostic presentation. We'll talk about that as well. So that's, again, doing the exam and kind of doing a talk over would be the Reader's Digest version there. Number three is what we consider the first close. And I don't like to use the word close, but it really is a presentation and allowing the patient to make a decision. Number four is questions and objections, allowing them to make objections. You actually want to know their objections at this point. And again, not that you can overcome them, but just to find out where they're at. Number five would be the second close. We've got to perfect that system as well, where we then, again, a close to me is not the hard close in selling. It is simply presenting a case and allowing the patient to make a decision. That's what I mean by a close. Number six is financial arrangements, making sure that system is nice and smooth so we don't have a obstacle there, nothing that would make the patient put up a hard stop at that point. And number seven is scheduling. So all seven of those things are necessary. All seven of those things have to be smoothed out in order for you to get the perfect case acceptance that we're talking about on this show. If you're too weak or too strong in any of those areas, you're going to push the patient away. And if you get to a point where you're selling in healthcare, if you get to a point that you're too strong, I told you, it destroys practices. This is a point where patients don't just quit your care. They don't just say yes to you, walk out, and never come back, but they also go and tell everybody they know to stay away, as far away from this practice as they can, because it's all about the money. You may have seen some of the Yelp reviews of some chiropractors out there who do these things. I certainly have, and I've certainly worked with a few of them to try to balance that presentation. So in Perfect Case Acceptance, we are working on balanced presentations, and we're going to be working on it every Wednesday. So make sure you don't miss a Wednesday show. And in fact, I don't have it in there yet, but I will put a link in the comments to High Performance Chiro 2.0, the Facebook group, where we are going to be digging a little deeper into some of these techniques and answering any questions you might have. So enjoy your Wednesday. I'll see you all tomorrow morning for Referral Mastery, which is going to be a great show. I'll talk to you later.